Thanks to Pioneer Health Center, today I'm able to treat a wider range of patients in-house and not have to refer out because I feel limited in my toolbox. My name is Dr. Mina Kim. I'm in Stamford, Connecticut, and I'm a naturopathic physician. Before Pioneer Health came into my practice's life, I was a typical naturopath. Supplements, diet, nutrition, whenever necessary, I would refer out to a different practitioner should my patients need something that I didn't have access to or I wasn't familiar with. So I met them and they pitched their first LD product to us, LDN. I thought, great, started using it, and immediately my mind was blown because now all of a sudden I realized I can help all these patients I really didn't have a tool to help them with, particularly my Ehlers-Danlos Syndrome patients, but overall just pain, autoimmune. They all got LDN. And then I attended a hormone course brought to me by Pioneer, and that gave me access to the hormone replacement therapy through Pioneer. Game changer. Yes, nutrition and supplements, vitamins, minerals, functional medicine, all of it, very, very helpful for hormones. But certainly my severe perimenopausal sufferers struggle really hard. With access to that, Pioneer has changed my ability to help patients quickly. Functional medicine is what I do, but it takes a long time. And then comes along compound pharmacy, and we're talking simple things, topical things, one pill things, that just overnight changing my patients' lives. Most of my patients are very scared of pharmaceuticals. I am getting them re-involved with mainstream medicine in a way that is safe, with integrity, and they feel protected. It's been amazing. What it's been like to have Pioneer as a source for medications for my patients, it's been nothing but positive. Allowing my patients to have access to a different kind of medicine that's outside of functional medicine has been very helpful, but even more, the help that I get from Pioneer, particularly Mike has been instrumental. So to have that access to be able to help my patients, and he helps my patients too. Anyone who talks to Pioneer on the phone, those guys are so nice. They only want to help. What made me say yes to collaborate with Pioneer Health Center is they came into my office to talk to us about LDN. And the presentation is what got me, because they weren't just selling a product. Jean Gresh really went through the biochemical pathways, and to see a pharmacist talk in this way impressed me. Right at that moment, I said, yes, this is good. On my end of things, I started seeing the way that Pioneer Health compounds their topicals, and it got me thinking, maybe they can help me with some of the supplements. I had a patient who could not tolerate oral, but they needed a high-dose antioxidant. And Mike Gresh worked with me to develop that. A supplement through a compound pharmacy delivered in a non-oral way. It was amazing. What I've tried in the past that didn't work for me, that I have found success with in Pioneer's products, are my more complex cases. Pain that dietarily, breath work, movement work, supplement, functional medicine work could touch, but not enough to make a difference in the patient's life. The thing that surprised me the most about working with Pioneer Health is that I am now thinking favorably on pharmacies. That was not the case before.